Good evening to you all. Today we are going to do pharmacology MCQ challenge. Why this subject is important? It carries 20 to 25 marks, 25 questions in the Neet PG and about 18 questions in INICT. And you can solve most of the questions of medicine and pediatrics if you have a good knowledge of pharmacology. So let us begin with the first question. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytate, B. Simultaneous ingestion of lactose, C. Acidic environment, D. None. See, what is the main clinical effect of vitamin D? The main clinical effect of vitamin D is to enhance intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, its net intestinal absorption is only 150 to 250 milligram per day. This calcium is absorbed mainly in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism regulated by 1,25 dihydroxy vitamin D, that is calcitriol. Parathormone indirectly promotes the absorption of calcium by increasing the renal synthesis of this 1,25 dihydroxy D3. Dietary lactose, proteins, and acidic environment promote calcium absorption. So the correct answer here is A. Simultaneous ingestion of phytate. Which of the following is a drawback of extended release preparation? Now let us look into the extended release preparation. Extended release drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the day, that thus avoiding peaks of high and troughs of low plasma concentration. By delaying drug action, the number of doses required considerably decreases and hence compliance increases, though the cost is higher than normal preparation drugs. Extended release drugs, if taken with food, more amount of drug can be released, which can cause toxicity. So the main thing is there is increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? See, the drugs with established toxicity in case of Crigler-Najjar syndrome are irinotecan and atazanavir. These drugs are metabolized by glucuronidation. Now, let us look at the options. A. Tenofovir, B. Zidovudine, C. Atazanavir, D. Nevirapine. So the correct option here is C. Atazanavir. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity. See, an acidic duct is maximally ionized in the stomach, but as it has a thick mucosa and small surface area, maximum absorption takes place in the small intestine. So correct option is small intestine. Which of the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A, D. Estrogen receptor. It is GABA A. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Anandamide is a cannabinoid neurotransmitter. Anandamide, also known as N-arachidono-ethanolamine or AEA, is an endogenous cannabinoid neurotransmitter. The name is taken from Sanskrit word Ananda, which means bliss, delight, and amide. It is synthesized from N-arachidono oil phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase enzyme, which converts anandamide into ethanolamine. So the correct answer here is D, cannabinoid neurotransmitter. The drug in the delivery system given below is A for topical use, B systemic use, C both topical and systemic use, D none. Well, it is the transdermal patch, and this route is for systemic use of drugs. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? Now look at the X-ray carefully. What do you see here? Here it is an X-ray of pulmonary arterial hypertension, and they have given as a stage 4. Epoprostenol is a drug which is used for this. So the correct answer here is C, epoprostenol. Acidic drugs bind to. Now, acidic drugs bind to albumin. Acidic drugs are best absorbed in the stomach, whereas basic drugs are best absorbed in the intestine. Acidic drugs are ionized in the intestine. Basic drugs are ionized in the stomach. Acidic drugs excreted quickly in alkaline urine. Basic drug excreted quickly in acidic urine. So the correct answer here is C, argon. Drug in the picture is used for, well, it is pill 72, levonorgestrel tablet. A, breast cancer, B, routine contraception, C, emergency contraception, D, abortion. Well, the correct answer here is emergency contraception. Two tablets of levonorgestrel given in the picture are used 12 hours apart for contraception. Sucamdex is used for A, organophosphate poisoning, B, reversal of neuromuscular blocker, C, treatment of local anesthetic poisoning, D, treatment of central anticonvulsant. Sugamdex, also called Reversi, it is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant rocuronium and vicuronium. It is a modified bicyclodextrin with high affinity for rocuronium and vicuronium. It encapsulates one molecule of neuromuscular molecule within blocker within its molecule, forming an inactive chelate which is excreted in urine. So the correct answer here is B, reversal of neuromuscular blocker. Mode of excretion of cyclophosphamide is A, lung, B, liver, C, kidney, D, skin. Cyclophosphamide is primarily metabolized and metabolites are excreted in urine. So the correct answer is C. Please click the link in the description to join the 3-day Ultimate Neet PG Breakthrough event covering all the 19 subjects in a holistic manner. And the first 10 people who click the link in the description box in this video will get this masterclass absolutely free. You will get the details in the WhatsApp group and it will be of 3 days duration. And it will be a good use of your time and it will take you to preparation to the next level. What is the type of receptor given in the picture? A, GPCR, B, ion channel receptor, C, enzyme link receptor, D, nuclear receptor. It is an ion channel receptor. Duration of action depends on A, clearance, B, rate of elimination, C, bioavailability, D, all. It is all. Which of the following drug can cause thyroid dysfunction? A, amiodarone, B, ampicillin, C, ibutylite, D, acyclovir. It is amiodarone. The drugs causing hypothyroidism are lithium, sulfonamide, phenobarbital, phenytoin, amiodarone, PAS, rifampicin, carbamazepine. Which of the following anti-migraine drug might have caused the side effect in the picture? A, sumatriptan, B, propranolol, C, methotrexate, D, ergotamine. It is ergotamine. C, ergotamine can cause severe peripheral vasoconstriction and gangrene in organs with end arteries like fingers. Dopamine, all of the following is true. A, causes increase in GI ischemia. B, positive inotropic. C, improves signal perfusion. D, vasoconstriction causes. The correct answer here is causes increase in GI ischemia. It doesn't increase in GI ischemia. In fact, it the side effect of digitalis are all ventricular tachycardia, vasodilation, nausea, and vomiting, ventricular pressure. In fact, digitalis causes mild vasoconstriction, not vasodilation. So the correct answer here is D, vasodilation. Anti-androgen used in heart failure is A, carvedilol, B, sampatrilate, C, spironolactone, D, abiraterone. It is spironolactone. Which of the following drug might have caused a side effect given in the picture? A, antacid, bismuth, C, saprate, sucralfate. It is bismuth. Gemcitabine is used mainly in which cancer? A, colorectal, B, breast, C, pancreatic, D, craniopharyngioma. It is used in pancreatic cancer. Maximum liver toxicity is seen with which anti-TB drug? A. Isoniazid, B. Rifampicin, C. Pyrazinamide, D. Streptomycin. It is pyrazinamide. Correct answer here is C. Pyrazinamide. Fastest acting antiviral drug is A. Iodide of NAK, B. Propylthiouracil, C. Methimazole, D. Nitrate. It is iodide of NAK. Natalizumab is used in treatment of A. Multiple sclerosis, B. Breast carcinoma, C. Psoriasis, B. Cell lymphoma. It is multiple sclerosis. Special feature of Glargine insulin is it produces a smooth, peakless effect. B. It is not suitable for once daily administration. It remains soluble at pH 7. It can control mealtime effortlessly. It produces smooth, peakless effect. Mechanism of action of trilostane is A. 11 beta hydroxy is inhibitor, C. B. 1 alpha hydroxylase inhibitor, C. 3 beta hydroxy steroid dehydrogenase inhibitor, 7 alpha hydroxylase inhibitor. It is 11 beta hydroxylase inhibitor, 3 beta hydroxy steroid dehydrogenase inhibitor. So it is C. Treatment of choice for cheese reaction is A. Prazosin, B. Pentagocin, C. Pentolamine, phenoxybenzoate. It is pentolamine. Essential drugs are A. Included in national pharmacopoeia should always be present at PHC. Those that satisfy primary healthcare needs of population, D. Life-saving medications. It is those that satisfy primary healthcare needs of population. Post-marketing surveillance is included in which phase of drug clinical trial? A. 1, 2, 3, 4. It is 4. Which of the following is most active against slowly dividing tubercle vessel? It is rifampicin. Drug contraindicated in G6PD deficiency is A. Chloroquine, B. Primaquine, C. Quinine, D. All. It is all. Which of the following anti-cancer drugs are competitive inhibitor of tyrosine kinase? Imatinib and sunitinib, B. Letrozole, C. Bicalutamide, fulvestrant. It is imatinib and sunitinib. Which of the following drug might have caused the effect given in the picture? It is insulin that has caused this. It is lipohypertrophy. Is a monoclonal ranibizumab is a monoclonal antibody against A. IL-6, B. CD20, C. VEGF, D. EGF.